Well, Kelly, how do you think that physical examination went?
I think I did a very good job.
Okay.
I was good.
All right. What was good about it, do you think?
Well, I was very thorough, and I did everything according to textbooks, and so I'm quite happy that I covered all of the issues.
Okay, right. So you certainly were thorough. There's no question about that. I think you did everything from the top to the bottom, and you were very thorough in that regard. Could I ask you what you thought was wrong with Warren? But prior to actually examining, did you have any working hypotheses or diagnoses, differentials?
Yeah. Well, I think it was something maybe respiratory or cardiac.
Right. And anything in particular in respiratory and cardiac?
Yeah, maybe a little bit of pulmonary edema, maybe because he had the ankles.
Ankles, right.
Yep.
And respiratory?
Well, I think just with he had a bit of cardiac overload, maybe, and so that sort of had led to a respiratory problem.
So you were looking for cardiac disease predominantly?
Yes.
Yeah. Okay.
Yep.
All right. Okay. Well, one of the problems with someone like Warren, where the disease is undifferentiated, in the sense that he's breathless and had a little bit of ankle edema, and that's really about it, wasn't it, from his history, as I remember, from what you told me. So the issue is, what's he likely to have? And I just wondered whether you might have entertained the diagnosis of COPD. He's been a moderately heavy smoker for most of his adult life. Do you think?
Yeah, that's a possibility. Yes.
Right. So, and then if he had heart failure, and COPD, say, is the most likely diagnosis, that might sort of dictate what signs you might look for. Is that reasonable?
Yeah, I think that's what I did.
Okay. Yep. No, I think you did you did do that in there. I'm just wondering about some of the other things you did, like looking at his throat, looking at his ears, feeling for glands in his throat and so forth, and whether you thought, looking back, whether that was an appropriate thing to do or not.
Yeah, well, I think it's important to be holistic because, as you said yourself, we don't really know what's wrong with Warren, and so I think it's very important to get a holistic picture of what is wrong with him so I can make an accurate diagnosis, and I think that's what I did.
So, Kelly, just to sort of summarise things and going back to the form, and that is, so the domains that I think are relevant here, I didn't see you interview the patient, but in terms of the physical examination skills, I thought your physical examination skills were reasonable, and satisfactory. In terms of your interaction with the patient, your professionalism and humanistic qualities, they were fine. You respected him. You were gentle. You weren't rough. You kind of explained what you were doing, and you were pleasant, and I'm sure he was very appreciative of that.
Yep.
In terms of your clinical judgment, that is an issue that we've talked about, and I thought in that way I'm sort of just going to say that it was because I think you were overly inclusive, and this actually cuts to the next dimension, which is organisation and efficiency. I think that was kind of borderline unsatisfactory, satisfactory, okay? Mm-hmm. And for the reasons that I've given you, that I think it was overly inclusive and you didn't use your time effectively, okay? In terms of the overall clinical competence, I'd have to say it was probably, again, a bit borderline, but probably just on the satisfactory side of borderline. So I think if you think about the things we've talked about, I think you've got some room to improve there. But I just need you to think about it and just think a little more critically about what you are looking for when you examine patients. Okay?
All right, that's fine.
All right, so we might leave it at that.
Fine.
Okay, thanks.